Hello, hello. Welcome to this Friday's Physio live Q&A. As everyone's joining, I just want to introduce myself and maybe have a sip of coffee. As you know, normally Physio live Q&A is at 1:30 p.m. So a little bit of an earlier start this morning. And it would be great to hear all your questions that you have on injury, pain, illness, recovery from COVID, your training questions, anything about nutrition, recovery, those kind of things. So please do start to ask your questions as you come in. As usual, I have some advanced questions that people have asked me. If you're watching live and you have asked me some advanced questions, please do still comment in the side there, because then I'll make sure I answer your question first. So whoever gets in there first with their live questions, I will answer them. So please do, before I start answering the questions, as usual, I do like to do a bit of a tech check. So could you let me know if you can see me and hear me loud and clear on Facebook, YouTube, Twitter, Instagram? I've missed one out. Don't think so. If you could just type in the comments, yes, we can hear you on Facebook loud and clear, or whatever you're watching on, that would be great. And then I know I can commence with the questions that people have asked me in advance. So I can see that people are joining live now, which is great. So please do let me know any questions that you have about any pain, injury, your training, fitness, COVID recovery, you name it. Please do let me know. Good to hear that you can hear me on Facebook. So please do. I can see, Claire, you have asked me a question in advance, so I will answer your question first. Those of you watching on Instagram, YouTube, etc., please do let me know that you can hear me loud and clear, and I will then answer your questions too. So just a little bit of background. As I mentioned at the beginning, my name is Lucy McDonald, and I have been a physio for 20 years, and I am super passionate about sharing all the knowledge that I have with you and helping you and your families, friends, colleagues, the more the merrier, to stay fit and healthy, and to answer any questions that you have about pain, injury, COVID recovery, etc. I'm going to be referring to exercises and videos. The place to find those, you'll see at the bottom there. The place to find those is on www.octopusclinic.com. So please do go and check out the website there. And then at the top, you can either use the search tool to put in whatever you're interested in, or you can go, if you want to go straight to the videos, you go to the video section, and you can find a whole playlist on things like running, back pain, knee pain, etc. So they're all sort of categorized so that they're quite useful. And also we have a YouTube channel. If you're not watching this on YouTube, please do go and check out the YouTube channel, because again, we've got playlists on there of all different topics. So super useful things. For example, if you're a runner, there's a video on the best exercises for runners. If you've got back pain, there's a whole series of exercises on what's causing your back pain, when is back pain an emergency, best exercises you can do sitting at your desk, all those sorts of things. So please do go and check those out. Right, I'm going to start to answer the questions that I've been asked in advance. This is a bit of a different time this morning, so do let me know if 9 o'clock suits you guys better. Generally 1:30 suits me better, because that's when my kids are out of the house. But it's half term, so it doesn't make any difference. I thought we'd mix it up and do it a bit earlier this morning. And I appreciate my coffee all the more at this time of day. So I'm going to start with a nice straightforward question, which is a very, very common one. So this comes from a runner, and she asks, do I have any advice for tight calves? Now, this is such a common question. You'll be pleased to hear that I have done a whole video on this very topic relatively recently. So if you do want to, I will answer your question, don't worry right now. But if you do need a recap, then please do go onto the website and put in calf pain runners or something like that, or just calves or calf or something like that, and you'll see my recent video that I did all about this very topic, because it is very common. And at this time of year, obviously people are starting to think about getting back into running, especially now that it's not quite so cold in the UK. People are starting to put their running shoes on or going a bit further with their running. So that's when these little kind of niggles can pop up. So calf tightness. Now, there's a bunch of things that I need to run through around the calf. So if you have pain in your calf, so at the back of your calf muscles, we need to really distinguish between pain and sort of tightness, stiffness. I'm going to cover the pain element first, just because it's important, because I haven't actually assessed you. I need to run through all the different possibilities, but then we'll get onto the most glaringly obvious one. But first of all, I just need to say, with any kind of calf pain, we do need to keep an eye out for things like DVTs and compartment syndrome and other less common, rarer musculoskeletal issues that can cause calf pain. But they are much less common than your absolutely run-of-the-mill, should we say, calf tightness. So if it is indeed just tightness, then it's extremely unlikely to be those severe conditions that I just mentioned. But it's always worth getting any kind of pain, any kind of severe pain in the calf checked out. So what do you do about just sort of generic tightness? Well, first of all, any kind of tightness in muscles is usually because they're being overused, or not overused, but used more than they're used to. So what happens is the muscles, there's a little bit of microtrauma to the muscles. So muscles are made up of tons and tons and tons of little fibers. And if you use that muscle more than it's used to, you end up with a little bit of damage to some of those fibers. Now, that damaging the muscle process is actually part of the process of building muscles. So it's the same with anywhere in your body. It's the same reason why if you go for a longer run than normal, you feel a bit achy. If you do a particularly intensive HIIT workout, then you'll feel a bit achy for a couple of days, because that inflammatory process can take up to 72 hours. So that's why often day 2 it's a bit sorer. But all of those things are all about creating a little bit of microtrauma. And then what the body does, which is totally awesome, is the body responds by creating more cells, bigger cells, stronger tissues, more resilient tissues, and you end up stronger, fitter, more resilient. Okay, so then you're able to build up your training and your resilience. Now, it is a wonderful process, but it does need certain ingredients. And when people end up with either an injury or sort of persistent achiness, stiffness, pain, there's normally something in that what's the word I'm looking for? Not menu. What's the word? Recipe in the recipe that isn't being put into place. So the ingredients required are, number one, time. So you need to have, your body needs to have enough time to recover from that initial microtrauma in order to adapt and repair and get stronger. Your body also needs to sleep. So sleep is when we get really good regeneration of all of our cells. We need to have the right food. So we need to make sure we're getting the right nutrients into our body. So we need to make sure that not just more obvious things like complex carbohydrates and protein. We need to make sure we're getting loads of fruit and veg, good fats, lots of wholesome foods. So and last but not least, stress. We need to make sure that our stress levels are managed well, because if we're constantly in a state of high stress, then that can affect our recovery and our healing mechanisms. So you need to make sure you put all those things in place, and that's the most important thing. And I've done a whole video on that. So again, I would recommend that anyone who's injured or who wants to kickstart their recovery when they're training, please do go and check out the video on octopusclinic.com about recovery. So if you just stick the word recovery in the search tool at the top, it'll pop up and you'll be able to watch it. So those are the ingredients that are required for recovery. And I start with those, knowing that most people, when they say to me, what should I do about my tight calves? You're probably expecting me to jump in with some exercises and stretches. Now, I haven't jumped in with exercises and stretches because they are not the most important thing. All of the things that I have mentioned to you so far are genuinely the most important. And I often joke that if people did all of those things really, really well, then we'd probably all be out of business. So please don't underestimate the importance of those things. They are in your control, albeit they are things that involve lifestyle changes. So they are challenging to implement. Now, in terms of stretches, a lot of people, when they have tightness in their calf muscles or other muscles in the body, they will do loads and loads of stretching. And unfortunately, there's just not that much research to back up what or for that matter, clinical reasoning as to why just stretching, passively stretching a muscle might help it to recover. The jury's a bit out on that. There's some discussion around it, and actually the best thing to do is, and the reason that I think that stretching feels so good is that actually when we stretch, it really helps us to connect. And I don't mean this in some sort of weird hippie way. I mean on a sensory level with that part of the body. So for example, when you do a nice calf stretch, you can feel that calf stretch. You focus on that, the feeling in that calf muscle. And those kind of things might well be the mechanism by which it makes things feel better. So yes, when you've done your run, it's a good idea to do some nice gentle, and gentle being the key word, gentle calf stretches. So you've got two main muscles in your calf, so it's good to do some stretches with your knee slightly bent and also with your knee straight, and you'll feel the difference. There'll be different parts of your calf muscle will feel like they're being stretched. So that's the stretching side. Now, if we now come right back to the beginning about what I was talking about with regard to tight calves, normally when something's tight, there's something weak. And here's the key. It would be a good idea for you to do some kind of calf strengthening. However, if you're going to do that, you're then going to need to reel in, not stop, but reel in your running, depending on where your comfort zone is. So reel in your running to a very comfortable zone and do some calf strengthening exercises. So things like heel raises, drops off the bottom of a step, to make sure that you're strengthening your calf muscles in a way. Oh, I think we might have lost Insta again. Oh, sorry, let me just. Sorry. So yeah, so you want to be strengthening those calf muscles in order to make sure that they can cope with the loading, the repetitive loading of running. So that might be something that we'd look at, is maybe looking at your training program, pulling it back a little bit in order to then introduce some strength and conditioning stuff, especially as most marathons aren't happening until autumn now. So if that's the case with you, then I would certainly recommend having more of a focus at this stage, and this is for anyone that's doing kind of autumn or end of summer marathons or running events, is to really focus on your strength and conditioning right now, rather than trying to sort of really build up your running distances and at this stage. So you want to be really getting those foundations in. And if you're not sure about what I'm talking about, do go and look at that video, The Best Exercises of Runners, because I talk about things like squats, lunges, and other bits and bobs in there too. So that's your calf strength, but actually then looking at more of your general muscles, as I've mentioned, if your other muscles that are supposed to be taking the load of running are not really strong, then it might be that your calf muscles are taking too much the load. It might also change the way that you run, so that you're putting too much strain through your calf muscles. So looking at that sort of general strength of your body, the strength of the main muscle groups that are required with running, so things like your quads, your glutes, not to forget the glutes at the outside of your legs. And you can go and have a look on the running playlist on our website, and you can see, as I said, lots of lovely exercises on there for strength and conditioning. So your heel drops, your squats, your split squats, core training like planking, and I feel like I'm missing out a really obvious one. Anyway, lots of lovely exercises on there, so please do go and check those out. And then also looking at your alignment of the way that you're running. So there's a lovely exercise on there called the Running Man, and that helps to look at training those nerve connections, those sensory nerve connections between your body and your brain. So for anyone that's watching this as who is a runner, I hope the answer to that question has been helpful, but please do let me know, Claire, if that has answered your question. And if there's any gaps in what I've said, please do let me know. So for those of you who are rejoining me on Instagram, I'm really sorry about Instagram going going off there for a second. Welcome back. I will continue to pursue my technological knowledge and sort out Instagram, because at the moment I'm streaming simultaneously to the other platforms, but not simultaneous to Instagram, so it's on a separate platform. So if anyone's watching this and can help me out with that, that would be great. So back to the questions, but I'm glad that I've answered those questions. For those of you that are joining on Instagram at the moment, if you missed that first question, please do go and check it out on Facebook, YouTube, Twitter, etc. Okay, so on to the next question. Right, let's have a look. When I did the virtual marathon, woo! And for those of you who know, you must know that the London Marathon was virtual last year, I'm sure. So when I did the virtual marathon last year, I got injured as a dog hit me in the back of my right knee. Oh my goodness. I've gone back to training slowly, but I keep getting pain in my right knee where I got hit. What advice would you give to help recover and be ready for this year's marathon? That is an unfortunate place to be hit, on the back of your knee. Okay, so it depends exactly where you mean by being hit on the back of your knee. Whenever there's some kind of trauma to the body, it's always important to think about whether there's the degree of the damage. Now, it doesn't sound to me, I mean, on the one hand, you've had it since October last year, which is a long time. But on the flip side, I'm not sure how the degree to which you're able to run, etc. I presume you've been training slowly. Okay, so the long and short of it is that if you've had an injury since October and it's still painful, I do think that it would be good to have a video consultation with you. That's the quick answer. It's not, there's a lot of advice that I can give around the sort of common running injuries or the common causes of back pain, etc. This kind of forum works really well with that, and I can direct people to exercises and things. But when you've had an unusual event where, for example, in this case, a dog, I don't know how a dog hits you in the back of the knee, but anyway, that it's a bit unusual, I do need to really assess and find out what's going on, because at the back of the knee, and there's a whole series of there's a whole playlist on knee pain on the YouTube channel and also on our website, so please do go and check it out. But so this is the knee, this is the model of the knee. Oh, we've lost Instagram again, so let me just turn it back on. This is the model of the knee. If you, unfortunately, the back of the knee is a little bit more vulnerable than the front of the knee, because you've got at the back of the knee, although you've got ligaments coming down the back either side here, it is there, you do have this sort of squishy bit at the back of the knee, which I'm sure you can feel in your own knee yourself. You have this squishy bit where you have a sort of direct route to the knee joint, really. So it could be that you have got some sort of damage to the meniscus or cartilage or ligaments inside the knee. So I would want to see you for a video consult just to check that out. Hopefully it's something more superficial, like, for example, a little bit of damage to your hamstring tendons either side of the knee, or perhaps where the calf muscle attaches the other side of the knee. So hopefully it's something more superficial, as I say, in other words, the sort of towards the surface. And it'd be good to know if, when you poke that area, not sure if you're watching live at the moment, David, but if you poke the area, if you can feel any tenderness. I would have thought by this stage, if there was any bony damage, that would have healed, but it depends on how you rested it, and then how you've slowly returned to training. Presuming, and it sounds like you've done this, presuming that you've returned steadily to training, it doesn't sound like the sort of thing that's going to go away on its own. And what we might need to be doing is, as I say, if I can see you for a video consult, work out what structures are involved, then I can give you specific exercises to target those structures that have been damaged and aren't healing on their own. So say, for example, it's a tendon injury, then we need to do loading exercises. say, for example, it's more muscular, although it doesn't sound muscular, there might be some kind of nerve component, and we might need to do some mobilization of the nerves or some mobilization of the joint or look at your alignment. It's really hard for me to answer that question on this kind of forum, but hopefully that's given you some kind of insights. If you, I'm presuming that you're doing all the things that I've covered before about recovery. So making sure that you're getting your nutrition right, sleeping well, excuse me, managing your stress levels, all of those things to make sure that you're really optimizing your recovery, and then also building up your running in small increments and looking generally at strength and conditioning. So try all those things. If that's not working, then please do get in touch. I do think we need to get that checked out. We've got tons of time until the marathon in October. If we can sort it out now, if we can get you going with some exercises, a few sessions just to progress and address the local issue, then I'm sure you'll be back on track and training in no time. So please do get in touch. So we've had a live question, so I'll answer that next. I've had heel pain in one foot and the other I have pain in the second toe. Oh goodness. Under the pad. I presume you mean under the pad, you mean the sort of front of the foot pad, the sole of the foot. It swells at the joint past the toe. I've not run for 5 weeks. The heel pain is easing. When I bend the toe on the floor, the toe bends, but not straight up. The joint bends towards the big toe. Can you answer me, have you ever injured that toe? In other words, have you ever landed and basically twisted it, or has anyone put their heel into it, or have you ever stubbed it aggressively, and particularly recently? Has there been anything traumatic with the foot, basically, of late? Can you answer that for me, Michael? I'm going to answer your heel pain first of all, while you give me a bit more information about the toe, because the toe one is unusual. So where is the foot? Okay, so this is Bob's foot. Bob is plastic, for those of you that might be squeamish about real bones. These are not real bones, these are plastic bones. Okay, well in that case, if you stubbed it, when do you think you stubbed it? Right, heel pain. So the heel pain in runners can be due to a number of different factors. Now, presuming that you didn't also jump and land heavily on your heel, or presuming that your heel pain, you're able to weight bear, jump on the heel without soreness, then it's unlikely to be a stress fracture, but it is possible. So it is one of the areas that we do need to be a little bit mindful of to make sure that you haven't got a stress fracture in that heel. But the most common injury in runners with heel pain is plantar fascia. So we call it plantar fasciopathy. It used to be called plantar fasciitis. It's because we now know that instead of it being inflammatory, which is the itis bit of the plantar fasciitis word, we know that it's more similar to the pathology that occurs in a tendon, hence why we also call tendons tendinopathies rather than tendinitises nowadays. So anyway, bit of semantics there. Probably not interested in that component of it, unlike me. But anyway, so heel pain in runners is most commonly due to plantar fasciopathy. There are other diagnoses, there are other things that could be causing it. So I would always recommend, especially with any kind of foot pain, that you get it checked out, have a video consult. So yeah, if presuming we do decide that it is a plantar fascia issue, then normally plantar fascia problems are as a result of either overloading. So I'm not sure if you watched the whole of the video so far, Michael, but all of the things that I talked about recovery, so making sure you're getting all those ingredients in place. Often people get plantar fascia issues if the load has just increased too much. too quickly. So, for example, people have either suddenly introduced hills, or suddenly increased the speed that they're running, or suddenly increased the distance, or shoved another extra run into their weekly program. And any one of those things could just, that sudden increase in load is just too much for the area to cope with. If you're a heavier person, you're going to be more predisposed to it, because again, those those changes in load are going to be steeper. So what can you do about it? Well, you need to look at that overall training program and address if you are doing too much too soon, and then if you're focusing enough on recovery. So when people set up their training programs, normally what they do is they focus very much on the running components of their training program. But what I would always recommend is that you put in there your the things that you're going to do to recover. So things like your nutrition, your stress management, so things like mindfulness, meditation, anything that you do with stress management, sleep, cross training, strength and conditioning. So you have all of those components in your training program, so that it's not just all sort of tunnel vision onto running. So on the stress thing, one of the things I didn't mention earlier, I've done the video on all the things that you can do to recover, but I've also done a video on management of stress, and just some really straightforward things that you can do to manage stress. So do check out those two videos. They're either on the website www.octopusclinic.com, or they're on the YouTube, or they're on both on the YouTube channel. So if you go to the website and you stick in recovery at the top of the search tool, it'll come up. The recovery video come up. If you stick in stress, then that video will come up. So I suggest you watch those. Anyway, back to plantar fascia pain. So look at that overall picture, and then we can look at your specific body, because obviously there's some reason why that heel is becoming overloaded more than the rest of your body. Let's have a look. I'll come back to your toe issue in a minute. So we need to look at the common things that cause or can contribute to plantar fasciopathy are weakness in the calf muscle and stiffness in the ankles. So the best way to work both of those components is to do heel drops off a step, and even better if you can bias the plantar fascia. In other words, if you can put a little bit more strain through the plantar fascia by flexing the big toe using a book or a weight, or as some of my patients have done in the past, a cork, a champagne cork or a wine bottle cork underneath the big toe, and then do heel drops. That can be really helpful, and making sure that you're going through that full range of motion. What's really important though is that you get the load right. Now, this is where seeing a physio comes in handy, because we have a very good idea of what that load is. I can't really advise you without specifically seeing you, because it's different for each individual person. Now, if you load it too much, you're going to flare it up. If you don't load it enough, then it isn't going to get better. So these kind of conditions do get better, but it's not a simple matter of just giving you an exercise and then you get on with it yourself. You can try it, but it is super common. Unfortunately, I've seen people that have had these kind of problems for a long time. As you might know, one of my specialisms is chronic pain. So I've seen them, and what can happen is people have been doing but I don't understand, I've been doing the exercises, but actually there's something about the exercise that isn't creating that load that's required to get the structure to recover, to get the plantar fascia to recover. It's often to do with, as I say, the amount of load, but also things like the angle at which they're doing so how much range of motion people are getting, how fast they're doing them, how much weight they're using with them, etc. The other thing that we need to do is to zoom out and work out why it is, again, that potentially that part of the body is being overloaded. So perhaps you're plonking down on the heel because, for example, your hip flexors are weak, or your quads muscles are weak, or your glutes muscles are weak, or your core muscles are weak. So have a look at the exercise, the running man exercise, and just take a little look and see if you can see any of those weaknesses. So if you go onto the website and you stick in Running Man to the top of the search tool, it'll come up and you can watch that video. And then you might see, for example, that your knee's dropping in. So you might then want to go and do some exercises for the muscles on the outside of the thigh with the wall ball series, or you might notice that your ankle's a bit wobbly. So you might want to go and do some exercises where you put a band around your ankle and strengthen your ankle muscles, those kind of things. So really useful to also have a look at the exercise before you do any kind of heel drops or heel raises. Have a look at the exercise video number 42, because in that one it shows you how to do heel raises to optimize the stability of your ankle and your foot. So hopefully that answers your the heel component of your question. But now to move on to your toe question. So for those of you that have joined us halfway through, the history of this was that Michael has soreness in the second toe, I think you said it was, wasn't it? Let's have a look. Yeah, second toe under the pad of the foot. It swells the joint past the toe. And then Michael goes on to say that he stubbed it. I did go to the hospital last week, but they said it was, if it was fractured, it would have started to heal and sent me home. Yes, so I do agree with what they said at the hospital. It's very, well, yes and no. So basically, the reason that they sent you home was because even if you did fracture your toe, it will heal on its own. But the best thing to do is to strap it. So if you get some, if you go to the pharmacy and you get some, or online, and you get some zinc oxide tape and you strap your toe to the next door toe, that will help to protect it. And also, but what's interesting, and then you do need to avoid anything that's painful, because if you fractured your toe and you start jumping around on it, there is no way that it is going to heal. So I very rarely tell people not to run. Most of the time, with most injuries, you will benefit from continuing to run. But there is one of the glaringly obvious exceptions to that is if you have a fracture in the bone. Now, because there's a chance that you have fractured the bone, Michael, I would advise that you don't do anything that's painful. And it sounds to me at the moment that that includes running. Certainly if it's fractured, it's highly likely to include running. So minimize walking. It's probably going to be things like walking fast, because obviously then you're pushing off through the toes more. But strap up the toe and avoid pain, and don't go and take loads of painkillers and then say, oh, it didn't hurt, so I went for a run. I mean, without painkillers, just allow yourself to be guided by pain. So otherwise it just won't heal, and it needs time. But the good thing is that bones heal really, really, really well, and you've got loads of time until whatever event you're doing, because there aren't any for ages. So in terms of the swelling, the reason I ummed and ahed a bit was it does also sound like you might have damaged a bit of the cartilage inside the joint. So just because you mentioned that there's swelling in the joint past the toe, it sounds like you might have a bit of not that toe, this one, isn't it? It sounds like you might have a bit of damage to the cartilage in there. So maybe when you stubbed it, it's possible that you created some bony damage, but also a little bit of cartilage damage, which has then created the swelling in the toe. Bearing in mind that you're going to immobilize it, I mean, if you do have private medical health insurance, or you can fund an MRI yourself, then that's the way to find out if it's fractured and or if you've got what sort of damage is going on in the joint. So I'd recommend that you do that if that's possible. But if not, I'm afraid it's a matter of avoiding pain, strapping it up, and waiting for time to do its beautiful job, or rather your body to do its beautiful job of healing. So hopefully that's answered your question, Michael, or questions. When you do get back to running with the heel pain, because inevitably, and this happens all the time with tendon issues, people think that their tendon issues or their plantar fascia is better because they've stopped doing the thing that creates the pain, i.e. in your case running, and hey presto, it gets better. But then the moment they start to load it again, the pain can come back. Now, it might not be the case with you, but there is a high chance. And if that does happen, don't panic. Just make sure that you gradually reintroduce the load. So really, really slowly, in small increments, gradually return to running. And likewise, if you're going to do those heel drops I mentioned, very, very gradual increases in the load. But once that toe has healed, if you want a video consultation, please do get in touch. reception@octopusclinic.com. Not a huge amount I can do with a fractured toe, so probably not worth you booking in for that, but certainly worth booking in with heel pain in runners. So hopefully that's helpful. Right, any other live questions? And I will answer the other questions that I've been asked in advance. So next question. I'm suffering with patellofemoral syndrome. Any ideas on how to overcome the pain? It's my knee that I've had an ACL and an MCL reconstruction on 10 years ago. I certainly do. Oh, you do have private healthcare, Michael. That's awesome. I would get it MRI'd and an X-rayed. You'll need to see your GP, who will probably need to give you a referral. And then, yeah, let me know. Will you let me know the outcome of the MRI? And then actually get 2 referrals for your toe, because while you're seeing a GP, you might as well get 2 referrals, or your insurance company might not make you see your GP, which would be even better. But get 2 referrals, or get 2 authorization numbers for your toe and for your heel, and then you've got those covered, so that when we get the results of the MRI, hopefully we get the all clear on any kind of bony damage, then I can see you, we can do some video consults and get you back to running. Yay, that's great news. Okay, so onto this patellofemoral joint problem. Oh, we seem to have some visitors. No visitors. We were almost joined by my children then, but they've gone. So, and for those of you that don't know what a patellofemoral joint is, it is your kneecap. So this is super common. So with or without the MCL and ACL issues, and for those of you who don't know what an MCL and ACL are, then this is your medial collateral ligament, MCL. So you're the one on the medial side of the knee, and then your ACL, you can see if I take the kneecap off inside the knee joint there, and it's a very common injury in runners, footballers, not runners, skiers, footballers, traumatic injury where you get a twist and a bend and a pop and off we go to A&E type story. Anyway, sounds like you've recovered from that, which is great, but it can be a contributing factor to patellofemoral joint issues for various reasons, which I might go into at the end, but I'm going to cover so it's really a very, very common injury. So patellofemoral joint issues can manifest as pain anywhere around the front of the kneecap. So you can get the pain under the knee, around the knee side, either side of the knee, and also it can move around. So that's quite normal. So lots of people are like, oh, I don't understand, I've got knee pain, it keeps moving around the place. It's quite common to do that, okay? Now, what it comes down to is looking at the mechanisms of how the kneecap work. And quite often the kneecap becomes painful because there's weaknesses in the hip, the foot, the ankle. So treatment is normally all about treating those things. However, this is the absolute crux of it. Those things need to be strengthened in the positions that you need your knee to work. Now, for the vast majority of people, that means standing. Okay, so I would strongly recommend that the exercises that you do for patellofemoral joint issues are in standing and involve variations on things like squatting, single knee bends, those kind of things. but target specifically the muscles that will help to restore the function of the kneecap. So for example, it's a very, very common thing that people will do with kneecap issues is that their knee will drop in relation to the foot and hip. So what a lot of people will then do is say, oh, well, that means as a result of that I need to do hip strengthening exercises to get my knee turned out. So they do a lot of exercises lying on their side, doing sort of clam type exercises. And then they can't work out why their kneecaps pain's not getting better. And often the reason is that although they're getting a lovely activation of those muscles in the buttock that keep their knee turned out, they're not getting the carryover into their standing, their running, walking, going up and down stairs, etc. Now, it's therefore important, if you are going to use those clam exercises, which actually, to be honest, I don't, and if anyone's ever worked with me, they'll know that I don't like clam exercises, but anyway, that they must then be followed up with exercises in standing. So a really good exercise for this is the wall ball series. And if you get the wall ball series right, it's absolutely brilliant for patellofemoral joint problems, coupled with exercises to look at the stability of the ankles. So looking at exercises like the exercises that I talked about earlier, like video 42, or the exercises with the band around the ankle, or the exercises to work on pronation. Very much depends on actually what the biomechanics of your leg are. So you know, do you have high arches, do you have flat arches, what's going on in your foot? Then we'll decide from there what exercises to give you. But those are basic principles, looking at the hip, looking at the foot, and then of course zooming out and looking at why it is that you're getting the problem on that side. Oh, hang on, I might just need to just pause for a second. Hang on, pause. 15 more minutes. I'm just live. Sorry about that, folks. Halfway through talking about patellofemorals and there's a bit of a noise, so I have to go and sort that out. Anyway, so we've talked about ankle stability, hip stability, and it's also worth looking at that general picture of what's going on with your training program. So just generally, have you been doing too much too soon, and have you addressed all those recovery factors that I've talked about loads? Also sort of general strength conditioning of your muscles, like your quads muscles, your hamstring muscles, calf muscles, core muscles. So one of the things I said that I'd mention around kind of ACL, MCL, there's two things that people find that you might have a little bit of residual weakness in your quads muscles, and possibly if you had a hamstring reconstruction, possibly in your hamstrings, you may not have retrained those adequately. So I particularly look at those, but also from a psychological perspective, we know that people struggle with loading the side that they've injured, either subconsciously or consciously, because they feel a little bit wary of that reconstructed side. So I would always recommend that you go really above and beyond the training with that knee. So gradually, slowly but surely, doing things like lots of jumping and landing and loads of change of direction work, so that you build up that confidence and that real you get rid of that psychological component. So really making sure that you're properly strengthening the knee. And the way to get confidence is often, as I say, to go beyond what your knee is normally required. So beyond what is normally required of your knee, so that then you're always well within your comfort zone, if that makes sense. So it would be fabulous to see you. I particularly enjoy seeing cases where people have had a problem for a long time and they're struggling to find a resolution. That is kind of my thing. So please do get in touch, reception@octopusklinic.com. But by all means, anyone who's watching this, if you do want a video consultation, they work really well. Go and check out our reviews on Facebook if you're not sure how they might work. Okie doke. So the last question, if anyone's got any live questions, please do let me know. But the last is all about pelvic pain. So this question is about a probable what's called osteosis pubis, and it's pain over the sort of front of the pelvis. Now it's an injury that can be very stubborn, but it does recover as long as the increments of load are very, very slowly but surely built up. So when this kind of pubic pain doesn't get better is when there's sporadic loading. So often I see people who have just gone back to, for example, running too quickly, or they've gone back to running, been absolutely fine, and then suddenly gone for a sprint. And that's when their pain has sort of come back. And when it comes back in a vengeance. So be really, really careful on your road to recovery with any kind of pelvic pain, that you're really, really steady, and that you consider all the things that could be affecting that pain. Now, the two main muscle groups that attach to the area or have an influence, their strongest influence on the area, are the adductor muscles that run up the inside of the thighs. So this is the pelvis, again, plastic, for those of you that might be squeamish. So muscles that run up inside, so that the pain can be felt at the front of the pelvis here, and the two, as I say, the two biggest muscles that have the greatest influence are the adductor muscles and then the muscles of the abdomen. So your rectus abdominis muscle, which inserts close to the joint as well. So what we need to do is make sure that we're managing the load, particularly of those two muscle groups, but also work out why it is that those two muscle groups are doing too much, and strengthen the muscles that can be doing their job instead. So, for example, in the case of the adductors, look at how you're walking, how you're running, and see if we can strengthen the muscles at the sides of the hips, which should be stabilizing the hips more instead of those muscles on the inside. And likewise, some of the other stability muscles of the lower back and the pelvis, strengthen those preferentially to the rectus abdominis muscle, so that muscle isn't having to do quite as much too. So that's the way that we treat that. It is something that I would strongly recommend that you see someone who's very comfortable with treating that kind of thing, and bearing in mind that it's often a chronic issue, so something that people have had for a long time. It's right up my street. So it's very rare that in these sessions I say, oh, please, I'd like to see you quite as frequently as I have today. So, but yeah, I would be very happy to see you. So please do get in touch, reception@octopusclinic.com. So I'm going to wrap up now, but just to say, unless anyone's got any live questions coming in, let me just double check. Oh, I hope everyone's been getting all their messages have been getting through. Anyway, I'll check the tech another time. But yes, please do invite your friends and family. I'll be going back to doing it at 1:30 p.m. next week. I think we get more people at 1:30 than at 9 a.m, but maybe it's because it's half term, who knows. So any feedback would be fabulous. There is tons and tons of free advice on the website. So go on to octopusclinic.com. Stick in whatever you're interested in the search tool at the top, and you'll see lots of things will come up, both video and written. And also there's a whole exercise video library on there that you can check out too. And also we're on YouTube and Facebook and Twitter and Instagram and all the rest of it. So plenty to get your teeth stuck into. So please do let me know if there's any gaps that we've missed and that you'd like us to do videos on next. But in the meantime, please do share with your friends and family, invite them all along next time, and I will see you for next week's Friday Physio Q&A. Thanks for joining. Bye.